So my name is Carolina Schinke. I am a associate professor at the University of Arkansas in Little Rock and mainly treat patients with multiple myeloma, other plasma cell dyscrasias like amyloid, Waldenstrom's, or myeloma precursor stages. And so area of research is really broad, and over the years has shifted also a little bit. I was initially a little bit more into basic and translational research, doing more lab work, single cell sequencing of myeloma cells in the bone marrow environment. And more recently, I'm also have become more interested in clinical trials. So I've worked a lot with bispecific antibodies in multiple myeloma, and now also CAR T cell treatment. So yeah, there's a broad interest in not just how these newer novel immunotreatments work, but also how we can mitigate side effects, how we can make it work longer, how to improve the immune system to be more receptive to these immune treatments. So yeah, that's all my interests really. Yeah. So I mean, the Monumental 1 study is that actually has been published already. That is was a phase 1, phase 2 trial of testing this novel bispecific antibody targeting GPRC5D in relapsed multiple myeloma patients. That was really the first of its kind study of this novel antibody in relapsed myeloma patients, and also eventually then led to the FDA approval of Talquetamab. Over 100 patients were enrolled in this trial, and efficacy was tested as well as side effects. Efficacy was overall really very impressive. I mean, we're talking about patients with at least 4 lines of treatment and who have been exposed to a variety of prior agents. And usually these patients, tend to have poor responses to further treatment. However, in these Monumental 1 trials, overall response rates were up to 70% with a really long duration also of response over a year. So very encouraging results for these patients. Now, what is very unique to Talquetamab, to this drug, what we realized in these trials is the side effect profile. So the GPRC5D that is being targeted by Talquetamab is expressed on plasma cells, but not only on plasma cells, it's also expressed on skin cells as well as on our taste buds. And so side effects that are associated with the Talquetamab are skin changes, rashes, and then also changes in taste, what we call dysgeusia. And so, yeah, these are side effects that obviously can impact quality of life. The skin rashes and skin changes, usually we can manage with creams, hydration, that usually gets better. What is more bothersome are the changes in taste. It leads to weight loss. It can obviously lead to decreased appetite, decreased food intake, decreased quality of life. And so this is something that's been looked at, that's been trying to get mitigated or to get treated, but it's just difficult overall. So that's still a work in progress, I would say. Now, the work that I'm actually presenting here at ASH is now doing a subgroup analysis and looking at patient populations, that benefit maybe more from treatment or that show more side effects from treatment. And one of our preliminary data that we've had from the Monumental 1 and that we really also observe in real world data is that African Americans might be more affected by the side effects from Talquetamab. Again, as GPRC5D is expressed in the skin, we tend to see that African Americans have usually thicker skin, more epidermis, and so there has been a hypothesis that maybe they're affected differently by the Talquetamab. And so we looked retrospectively at African American patients in the Monumental 1 study. Overall, it's a very small population, 10%, so roughly up to 17 of the patients were African American. So we're dealing with rather small population. What we could see in those is that response rates were overall similar. I think, we don't really have a signal there or a significant signal that efficacy is different in African Americans, but we did see a little bit more side effects. So skin rashes were a little bit more prominent in African Americans. That happened in over 90%. The same also with the dysgeusia, so a change in taste. I want to say it's overall very common in all patients. So also in Caucasians, there was over 70 to 80% had these side effects. In African Americans, numerically, it was just over 90%. Now, again, the patient populations are small, and so there's no real statistical significance to these values, but it just makes us think. And I think further studies and further evaluations will be necessary, really having a broader African American population to study these side effects. And then also to see, again, right now we don't really have a signal if there's a difference in efficacy, but, I think further evaluation will be necessary to see if it also maybe, maybe side effects are more, but maybe it works also more or not. So it will really help us to guide treatment also in the future and see, if we should give this drug, to African Americans, or maybe choose something else first before we expose them to Talquetamab. These data are very preliminary. Again, there's no very small patient population, no statistical significant values. So I wouldn't necessarily change practice right now based on this, on this abstract. But I think I would just encourage patients or treating physicians to also get their own experience, when they treat patients from different backgrounds, different races, to just explore and see if there are any differences in potential side effects. That's going to be something that we will explore further in the future.